We're in a period of the beginning of the recess for Congress. They go out for about 6 weeks or so, and they go back to their home districts. And a lot of the activity and focus will be in the home districts in the weeks ahead. You might have read or seen in the news a little bit about some of the town hall meetings that have been happening where members of Congress are going out and talking about what's happening in healthcare reform legislation. And it's been interesting because some of those have been pretty disruptive events. So there's a lot of attention being given to the issue, and now members of Congress are reporting back out in their districts. From Mayo Clinic's perspective, we continue to really emphasize the points that we've emphasized all along. The most important thing on the agenda right now from our perspective is to make sure we don't lose this really once in a long time opportunity to incorporate quality and reasonable cost into the reimbursement system for Medicare, specifically including what we call a value index, also to consider other payment mechanisms to really reward the organizations who deliver high quality care, meaning excellent outcomes, safety, and service at a reasonable cost. Today's health insurance reimbursement system does not do that, and we have to do that no matter what else we do. There will be a push potentially to focus all the energy on insurance, and while we believe it's very important to insure everybody in the country, if we do that without addressing the payment reform, we will not have done healthcare reform. So that's really where we're focusing our time and energy, to make sure that as we bring more people into the insurance system, that we don't bring them into the same system we had before. And we believe one way to do that is to begin to change the way we pay for care to pay for value. One of the things that any of us as a citizen can do, so any of us in our families and we as employees, can certainly become informed about the issues. The Mayo Clinic Health Policy Center website is a very good source for that information. I'd encourage you to take a look at it. If you're watching this video, you are probably connected to it in some way. Learn about the issues. If you support the position that Mayo has taken, and we're taking this because we really believe it's what's right for patients, we need to insure everybody, bring them into the insurance system. We believe the right way to do that is to bring them into a reformed health insurance system, that we shouldn't bring everybody into a Medicare-like program, and that we have to pay for value, to really change the way we do that so that the type of care that you provide here at Mayo is actually recognized and appropriately rewarded. So I think becoming informed and letting your elected officials know that you support that direction or articulate whatever you believe. This is a time when they're going to be out asking people for input, and it's a great time to do that. You can also do it via our website as well. So we welcome engagement of our staff in any way that you're interested, but letting your voice be heard at this time in the political process is one of the things that we can do as we live in a democracy like ours. In the next few weeks, the recess will continue, and politicians, our elected officials, will be out in their home districts, and I'd encourage you to participate in those events if you would like. You'll hear a little less going on in Washington, probably, and more of the attention going on in the local areas. But we'll continue to report to you what's happening and provide you updates. Mayo will stay very active during this time. Although some of it might be a bit less visible from a media standpoint, we don't know that for sure yet.